the second half of your 20 journey, you get into the gestational diabetes testing.
Correct.
What is the importance of that?
So the most important thing about that is baby. Okay. So whether you have diabetes or not, it's important just to keep you healthy. But when you have gestational diabetes, by default, that means you have more sugar in your body, right? But your own insulin can't suppress it. Well, the baby's insulin works just fine. So the baby will see all that sugar. So think of your baby swimming in a bowl of Kool-Aid, okay? Because that's what it's like to be a gestational diabetic and to have a baby, right? The baby's swimming in a bowl of Kool-Aid. So the baby has to increase its insulin in order to suppress all that sugar, okay? To use it like it's supposed to be used. Well, insulin is also a growth factor. So the more insulin the baby's pumping out, the bigger the baby is going to get. The bigger the baby, the harder it is to get that baby out vaginally and also via C-section as well.
Yeah.
In addition, a big baby like that, by default, unfortunately, puts the baby at risk for IUFD, intrauterine fetal demise, right? Which nobody wants to have a fetal death on their hand, but by having all of that going on, it puts too much stress on the baby's heart, and so then the baby could pass. After the baby's born, let's say everything goes fine, baby's just big, baby's now born into a world where the Kool-Aid is now gone. Well, with all that insulin going high, it's going to drop its normal sugar levels to even lower. And that's like diabetic coma for baby. So it's like the baby was like swimming in sugar, and then now it gets out into the real world and that sugar's not around, but it's still functioning like it is. It's going to drop its sugars like crazy. So then that baby has to be monitored more closely. I mean, sometimes breastfeeding will not be sufficient because the mom won't be able to make enough to keep up with the calorie requirements that that baby will need. And so they'll require supplementation with formula. So
what do you recommend around that time, how moms change their diet or start to like edit and be more cautious of what they're eating, really when they get into that 25 weeks or so and continue throughout the rest of their pregnancy to help control that circumstance?
So the best thing to do is just eat good throughout the whole pregnancy, right? Like so much easier said than done, right?
I'm like,
but easy, okay, no problem, done. But it's more about just making better decisions throughout, right? Like if you know every night you like to come home and have that bowl of ice cream, guess what? Maybe you cut it down to just 3 nights a week, and then maybe you get to a point where it's only 2 nights a week, and then you're like, okay, I just do it once a week, and that's okay. It's super, super important. Let's say you can't cut that out because for whatever reason, ice cream is real. It's a struggle for me. So I can only imagine being pregnant and that being a struggle. Then after you eat, you need to go out and do at least a 30-minute walk, like a good walk to immediately start burning off that extra sugar that you just brought into your body. By doing that, it'll keep your insulin levels from needing to like skyrocket. It'll bring it to a more normal level because it won't have to fight so hard to burn off that sugar because your activity is going to burn that sugar off.